Vitamin D deficiency is a condition in which the body does not have sufficient levels of this essential vitamin, which can affect bone health and other body systems. Vitamin D is crucial for the absorption of calcium and phosphorus, which are necessary to maintain strong and healthy bones. Below, I explain the most important aspects of this deficiency. Causes of vitamin D deficiency. Lack of sun exposure. Vitamin D is produced in the skin when exposed to sunlight, UVB rays. People who live in areas with little sunlight frequently use sunscreen or spend a lot of time indoors or at higher risk. Insufficient diet. Vitamin D is found naturally in few foods, such as fatty fish, salmon, tuna, egg yolks, and fortified foods, milk, cereals. A diet low in these foods can contribute to deficiency. Absorption problems. Some conditions such as celiac disease, inflammatory bowel disease, or bariatric surgery can hinder vitamin D absorption. Age. As we age, the skin produces less vitamin D, and the kidneys are less efficient at converting it into its active form. Darker skin. People with more pigmented skin produce less vitamin D when exposed to the sun, as melanin acts as a natural filter. Obesity. Vitamin D is fat-soluble and can become trapped in fatty tissue, reducing its availability in the body. Symptoms of vitamin D deficiency. In many cases, deficiency does not present obvious symptoms at first, but it can manifest in the following ways. In children. Rickets, a disease that causes bone deformities, delayed growth, and muscle weakness. In adults, osteomalacia, soft, weak bones, and an increased risk of osteoporosis, which increases the likelihood of fractures. Bone and muscle pain. Increased susceptibility to infections, as vitamin D plays a role in the immune system. Fatigue, depression, or mood swings. Some studies link low vitamin D levels with mood disorders. Long-term consequences. If left untreated, vitamin D deficiency can lead to fractures and osteoporosis in older adults. Cardiovascular problems. Increased risk of certain autoimmune diseases, such as type 1 diabetes or multiple sclerosis. Possible association with some cancers, although more studies are needed. Diagnosis. Deficiency is diagnosed by a blood test that measures levels of 25-hydroxyvitamin D, the circulating form of vitamin D. Ranges are generally classified as follows. Deficiency. Less than 20 nanograms per milliliter, 50 nmol, L. Insufficiency. Between 20 to 30 nanograms per milliliter, 50 to 75 nmol, L. Normal. 30 to 50 nanograms per milliliter, 75 to 125 nmol, L. Note. Values may vary depending on the laboratory or country's medical guidelines. Treatment and prevention. Supplements. If levels are low, a doctor may prescribe high doses of vitamin D, usually vitamin D3, cholecalciferol, for a short period, followed by a maintenance dose. The dose depends on the severity of the deficiency and individual factors. Sun exposure. Moderate sun exposure, 10 to 30 minutes a day, depending on location and skin tone, can help increase vitamin D levels. It is important to avoid sunburns. Diet. Include foods rich in vitamin D, such as fatty fish, eggs, and fortified products. Lifestyle. Reduce risk factors such as a sedentary lifestyle or being overweight. At-risk populations. Infants and young children, especially if exclusively breastfed, as breast milk is low in vitamin D. Older adults. People with dark skin. Individuals with limited sun exposure, due to climate, work, or clothing. Patients with gastrointestinal or kidney diseases. Warnings about supplementation. Taking too much vitamin D can be toxic and cause hypercalcemia, high blood calcium levels, which can damage the kidneys and other organs. Always consult a doctor before starting supplements. If you suspect you have vitamin D deficiency or would like to learn more about how to prevent it, it is important to consult a doctor for a personalized evaluation. Would you like to know more specific information on this topic?